Hey, so today we are going to talk all about Gestalt therapy. This is Future Ahead, and right now we are talking about different approaches to counselling and therapy. So, what exactly is Gestalt? Well, Gestalt is a humanistic style of therapy. It's actually derived from the person centered approach, which we went over in our previous video. And it focuses on how the client feels and experiences things in the present moment. So the difference here is person centered is completely client led. So we may ask questions and they will focus on the past. However, we want to bring the client into the current moment to sort of talk about potentially the past, potentially the future, whenever, but how we feel in the here and now. So, although Gestalt recognizes that we are made of different parts, it says that we can only experience ourselves as a whole. Therefore, we look at the patient and their experiences on a whole basis, and we even focus on the bodily sensations and how this intertwines with the person's experience of their memories, their present, their feelings. This idea of focusing on our whole selves and on our bodily feelings is supposed to increase the mind body connection of people undergoing gestalt therapy. So, with this increase in mind body connection, we can act with more intention and more personal responsibility. So, once we experience our true selves, we're more likely to produce positive changes in our behavior because we feel more personally responsible and we feel more positive about the actions that we can take. Also, this understanding of the present moment, this comfortability with the present moment and comfortability with our own feelings in the present moment is only going to produce productive change, positive change, because the person feels more in touch with not only themselves but with the environment. Generally, what we're going to find is that most of these therapeutic approaches are going to be suitable for someone with depression or anxiety. However, it kind of depends on the complexity of that depression and anxiety and the severity, as with any of these different mental health disorders or issues. So someone with low self-esteem may be suitable for gestalt therapy because they can have their worldview or their self-view challenged and begin to live in a more harmonious manner. Also, the experience of the present moment and the experience of the self in that present moment allows people to sort of let go of any negative beliefs. When it comes to PTSD, it can be especially helpful. What Gestalt therapy can be especially helpful for PTSD because this experience in the present moment, when focusing on the past, allows the person to see they're actually in a pretty safe space. So if someone looks at the past and they say, "Well, I'm sat in this therapy room here with you right now, and I feel safe, I feel comfortable." But then when I think of my past memory, I feel fear, I feel pain. Um, they can sort of see that they can detach from that, not by means of like derealization, depersonalization, more like in terms of, okay, well, I feel this fear, even though this is a past event in a safe place. And so instead, I choose to focus on this feeling of safety. And I come to understand that actually this past event no longer controls me. When it comes to eating disorders, we can also benefit from this mindfulness. So, you may have heard of mindful eating before. This experience of the present moment allows someone to sort of put in the back of their mind these negative past experiences, these negative emotions that come from core belief systems that drive eating maladaptive eating behaviors, and just sit and focus on that feeling of satiety, um, the actual eating itself, engaging with the food, feeling at one's bodily feelings and allowing someone to act through the healthiest version of themselves as they experience themselves and experience the world in completeness. Thinking about those patients with PTSD, there is some people that Gestalt wouldn't be suitable for, and those are the people that want to debrief and dissect the past. So, someone with PTSD may find the focus on the present actually invalidating, and that's the same for people going through depression, anxiety, relationship problems, any of those issues. Sometimes people want to sit with those feelings, those memories from the past, and that's okay. When they want to move on to the stages of calm within the present, that's up to them, and they may not be ready for moving on from those feelings. They may feel the need to dissect each and every element of their upbringing or the past in order to be able to fully move on because they want to understand. Likewise, they may want to go to a therapist because they want to be told reasons from a therapist. Usually, a therapist doesn't really give reasons when it comes to person centered, especially. The same goes for goal setting. That may sometimes people who are goal setting may be more suited to CBT or to coaching. And anybody who isn't comfortable with being closely observed by the therapist, this sort of depends on which type of Gestalt therapist the client goes for, because some Gestalt therapists are okay with challenging the behavior of their client. However, some of them really stick to that person centered and continuously ask questions. But we're going to get onto that in a bit when we look at the confrontation exercises done by a therapist. Now we're just going to go through some examples of different type of exercises a Gestalt therapist may do with their client. So first things first, we have the empty chair. So the idea of the empty chair is the client has a chair beside them and they are imagining the different parts of themselves that are potentially in conflict when they think of, for example, an event, an opinion, a belief, and they are having a conversation with the empty chair, i.e., with the part that they are in conflict with. So in this conversation, they will play out both parts. So they will then switch the chair to speak to themselves from the other part. So in doing this, they get to understand the perspectives on both sides, and through sort of communicating the incongruent factors at hand, they can then achieve congruence because they get a more balanced perspective of things. The next exercise is called exaggeration. So here you can sort of understand why Gestalt therapy may not be suitable for people that aren't okay with being closely observed. So when we think of a person who is potentially extremely defensive, has like a lot of fragility in their defense mechanisms, they may not be suitable for Gestalt because the challenge can come in with this close observation. We wouldn't want to inflict any wounds on someone's ego who needs to arise any defense mechanisms against that. So, what happens in exaggeration is the client will go through different situations, or they will just talk about their feelings. They will talk about whatever they need to talk about in the therapy room, and the therapist will observe the body language as you speak about whatever it is that matters to you in that moment. So it's a free train of thought, free train of speech, and the client will notice any sort of physical reactions to any body language that comes up, and they will point it out. And when they point it out, it's up to the client to reenact what they just said and to reenact the body language, however, to do it in an exaggerated manner. And once they've exaggerated that, they're then going to explore the emotion that came up for them when they went through that exaggeration. It's through doing this that the client can then understand the feelings they feel. surrounding the matter and anything that kind of went unrecognized. So then they experience themselves in whole completeness, and they can understand whether the emotion they have attached to that event is one that they want to stick with. So, more confrontation. However, this exercise in itself is actually called confrontation. So, here the therapist is going to identify anything they feel that the client is avoiding. So, remember from the person centered approach, we use advanced empathy. However, the idea of that advanced empathy was to just ask more questions so that the client can come to the conclusion themselves. Gestalt therapy can be a bit more pointed, so they will just directly say, okay, well, I think that this is coming up for you. How do you align with that? How do you feel about that? Do you think that you're avoiding X, Y, Z? So anything that the therapist has identified, they're just going to challenge the client and ask if they feel they are potentially avoiding any confrontation. And in that, the client can self-reflect and once again experience themselves in completeness. The thing here is, of course, not all Gestalt therapists will take on the confrontation method for the same reasons that I explained earlier, to do with defensiveness, but also to give more of a person centered approach to their practice. Now let's look at I statements. So, with I statements, you've probably heard of them before. This is often used in relationship therapy as well. The client is asked to come up with different statements that begin with I feel. So, through that, they're going to become more aware of their own emotions, their experiences, and they're going to take more personal responsibility, which is one of the main aims with Gestalt therapy. Thank you for listening to my mini lecture on Gestalt therapy. I hope that you enjoyed all my videos on the different approaches to counselling and therapists so that you can find the best therapy practice for you or inform your own therapeutic practice. Feel free to give a subscribe and a like, and see you next time.